It was up. This is Jeff of InnerFit, where exceptional fitness begins within. Thank you for stopping by. We hope that you will find today's episode of iFit TV to be helpful. We don't consider ourselves to be the authority for telling anyone how to live their lives. Only you can determine our value to you. On today's episode of iFit TV, we're going to be continuing the 7 functional herbs, spices, and seasonings series. Today we're going to be discussing cinnamon. Now, today's presentation is going to be somewhat twofold because I'm going to be talking about a chronic condition that's kind of going to benefit those that may be suffering from this chronic condition. I'm going to show how they can benefit from including cinnamon into their diets. Now, because of the amount of information that I'm going to be sharing today, in order to go into present it in a sequential manner, I chose to put it in a paper format, so I'm going to be reading. So here we go. Cinnamon is a spice that is obtained from the inner bark of the cinnamomum tree. Cinnamon contains iron, calcium, manganese, and fiber. Cinnamon has been used as both a culinary spice and a medicinal herb for thousands of years. According to Dr. David Jockers from the Exodus Health Center in Kennesaw, Georgia, cinnamon is one of the most powerful natural antioxidants available. It has the second highest content of antioxidant properties among all spices. According to Peter Ward from the University of Michigan, cinnamon contains a component known as cinnamaldehyde that reduces inflammation. According to Dr. Philip Zolak of Ohio Northern University, the aroma of cinnamon induces cognitive function and also improves recognition memory. Some other health benefits of cinnamon would include relief of arthritic pain. It improves digestion. It may prevent the development of urinary tract infections. It relieves menstrual discomfort. It also contains blood thinning properties, which would require anyone that's taking prescription blood thinning medication to consult with their healthcare provider prior to adding cinnamon to their diet on a regular basis. Now, I neglected to mention one other benefit of cinnamon because, in my opinion, this benefit is the most important benefit to be gained by including cinnamon into your diet on a regular basis. I'll tell you why. This other benefit of cinnamon addresses a chronic disorder that has reached epidemic proportions within the U.S. As of January 2011, estimates reflect that 26 million people in the United States suffer from this chronic ailment, and another 79 million are at risk for developing this chronic ailment. Complications related to this ailment would include heart disease and stroke. Adults that have this chronic disorder have heart disease death rates at about 2 to 4 times higher than adults without this chronic disorder. The risk for developing stroke is 2 to 4 times higher among people with this chronic disorder. High blood pressure. Adults aged 20 years or older with this chronic disorder had consistent blood pressure readings greater than or equal to 140/90, or they used prescription medications to control hypertension. Blindness. This chronic disorder is the leading cause of new cases of blindness among adults aged 20 to 74. Kidney disease. This chronic disorder is the leading cause of kidney failure, accounting for 44% of new cases in 2008. In 2008, 48,374 people with this chronic condition began treatment for end-stage kidney disease in the United States. In 2008, a total of 202,290 people with end-stage kidney disease due to this disorder were living on chronic dialysis or with a kidney transplant in the United States. Nervous system disease or neuropathy About 60 to 70% of the people with this disease have mild to severe forms of nervous system damage. Amputation. More than 60% of non-traumatic lower limb amputations occur in people with this condition. In 2006, about 65,700 non-traumatic lower limb amputations were performed on people with this chronic condition. I'm sure that you've already figured out that this chronic condition that I'm referencing is known as diabetes. Now, diabetes is a chronic disorder characterized by the body's inadequate production and use of insulin. The lack or reduced production of insulin within the body causes diabetes. The lack or reduced production of insulin within the body is what causes diabetes. Now, the role of insulin in the body. Insulin is a hormone that is produced in the pancreas that regulates the amount of sugar in the blood. Insulin is responsible for lowering the levels of sugar in the blood, and it does so by carrying or transporting blood sugar from blood into the cells. Insulin promotes the metabolism of the proteins, carbohydrates, and fats that we consume in our diets. Now, there are several classifications of diabetes. However, today we're going to be discussing types 1 and 2. Now, type 1 diabetes is a condition wherein the body produces very little or maybe no insulin at all, which causes an abnormal rise in blood sugar levels. Insulin injections are required to manage type 1 diabetes. Type 2 diabetes is a condition where the body produces insulin, but usually not enough to promote the body's metabolism. This condition may sometimes be managed with diet alone. However, tablets, pills, or insulin injections are often required in most cases. Now, how does cinnamon benefit people that suffer from diabetes? Well, one of the most important benefits of cinnamon is in its ability to stimulate insulin receptors. I'll read that again. One of the most important benefits of cinnamon is in its ability to stimulate insulin receptors, thereby causing the body to naturally release insulin. Cinnamon also improves the effectiveness of sensitivity of insulin. Cinnamon also slows the emptying of the stomach to reduce sharp increases in blood sugar levels after eating. According to Dr. Harry Prost, a medical doctor and professor at Georgetown Medical Center and the world's foremost expert on glucose metabolism, cinnamon's ability to help control blood sugar makes it a valuable tool for weight loss. The fat cells in your abdomen are very sensitive to high insulin levels and are very effective at storing excess calories that become fat. Research shows that cinnamon may actually mimic insulin, which can promote fat loss. 80% of the people that suffer from type 2 diabetes are obese. Now, concerning the science behind cinnamon, USDA scientists discovered that cinnamon significantly increases insulin production. I'll read that again. USDA scientists have discovered that cinnamon significantly increases insulin production. A study published in the American Journal of Clinical Nutrition showed that people who consume cinnamon daily have improved insulin functioning. Researchers have suggested that people with diabetes may see improvements by adding 1/4 to 1/2 teaspoon of cinnamon to their food, along with doing the other essentials to improve diabetes, including eliminating fructose and grains from your diet and exercising daily. Some ways to include cinnamon into your diet would be to add it to your coffee, tea, fruit, or on a baked sweet potato. You can usually find cinnamon tea in most grocery stores. Currently, most experts recommend taking a 500 milligram standardized water-soluble cinnamon extract in supplement form. I recommend you visit Swanson's Vitamins online. Tell them that Jeff from Interfit sent you. Now, today's presentation comes with a warning. Do not go swallowing cinnamon by the spoonful. Do not use very high doses of cinnamon on a daily or a regular basis. for when used frequently in high doses, it can become toxic to the liver. High doses of cinnamon can cause liver toxicity. If you have been diagnosed and are currently being treated for diabetes, do not replace any prescription medicine with cinnamon without consulting with your doctor, PCP, or your health care provider. If you have been diagnosed and are currently being treated for diabetes, do not replace any prescription medicine with cinnamon without consulting with your doctor, PCP, or your health care provider. In conclusion, I know the holiday season, which is once again upon us, is a time of year when the cinnamon comes out of the back of the pantry and is dusted off to be used as an ingredient in your sweet potato pie. Hopefully, when you're done using it for the holidays, you will leave it out on the dinner table next to the turmeric, which was the first spice that I discussed in this 7 Herbs, Spices, and Seasons series. You know where to find it on the spice rack in the grocery stores. Now, that's going to conclude today's presentation. I hope that you find this information most helpful. I know that there are a lot of people that are suffering from diabetes. If you have any questions concerning today's presentation, please give me a call or email me. I know the severity of this condition as a registered nurse in hospital. I don't work med-surg nursing anymore, but when I was working med-surg nursing, the average nurse to patient ratio would be 6 patients to the nurse. You could always guarantee that either 1 to 2 of your patients were suffering from diabetes. So diabetes is a serious condition that needs to be addressed in our communities, and I hope today's presentation will help you better address this condition, or help the loved ones that help address this condition. Until next time, be forever blessed by the only one that is able to do exceeding abundantly above all that you can ever ask or think. Thank you for watching.